This is Michaela Cagle on multiple sclerosis, also known as MS. MS is a chronic and progressive autoimmune disorder that can be disabling. To the left of the picture, you can see a healthy nerve. To the right, you can see where myelin has been damaged by the immune system, which makes communication between the nerves break down. There are 4 types of MS. The first is relapsing remitting MS, which is when symptoms appear periodically and symptoms can last for weeks or months and then go back to remission. Secondly is primary progressive MS, which is when symptoms gradually worsen after symptoms first appear. Next is secondary progressive MS, which is when, after years of relapses and remissions, symptoms suddenly begin to progressively worsen. Lastly is progressive relapsing MS, which is when symptoms gradually worsen after symptoms first occur. Some of the symptoms and causes that you may see with MS is numbness or tingling, impaired vision, muscle spasms, weakness or stiffness, bladder and bowel problems, slurred speech, difficulty swallowing, memory loss, and lightheadedness. The cause is unknown for MS, but some of the potential causes are genetic factors, which are seen in females, and genes coding for HLA-DR2. And some of the environmental factors are infections and vitamin D deficiency, which explains why there are higher rates of MS in northern and southern poles. Our patient is CJ, who is a 15-year-old from Seattle who plays recreational speedball. He has been experiencing off and on blurred vision and problems with his muscles, making it hard for him to play. He says at times he wakes up with numbness in his hands. He has been to doctors before about these symptoms, but was never diagnosed with anything due to lack of family health issues. When CJ came into the office, there were no physical signs of MS. We conducted an active range of motion test, which just consisted of leg bends. His right leg would bend fully with no pain, but his left would only partially bend, and he explained that it felt heavy. For his passive range of motion test, his right leg would bend fully with no pain, but his left leg would still partially bend with some pain. The blood test ruled out all other autoimmune diseases that mimic MS, and the MRIs showed white matter plaques, which are built up myelin. Due to his results, CJ has relapsing remitting MS. Our goal is to delay disability and prevent relapses. Exercise is a big factor in preventing disability for CJ. CJ needs to exercise as much as possible. This can be through swimming or cardio workouts and strength training. Because CJ is 15, he should start with lightweight training, and he should also stretch every day at least 2 times a day to keep flexibility and range of motion. Some weight training exercises that we have planned out for CJ are squats, bend over rows, and leg presses. For squats, we want him to start by standing, then squat as low as possible, and do 3 sets of 15. For bend over rows, we want CJ to make a 7 with his body and pull up the weight. For this, we want him to do 3 sets of 10. For leg presses, we want him to find a comfortable weight, bring his knees to his chest, and slowly push up. These exercises will allow CJ to continue to build muscle and decrease his risk of disability. In the right corner of this PowerPoint, there are examples of stretches that should be done every day and held for 30 seconds. These will keep CJ's body flexible. Sadly, there is no way to prevent MS. To conclude my presentation, these are my references.